Hi, this is the second presentation on the series of presentations that I planned for all my viewers on street drugs. The other one, the first one I presented last time, I tagged the street drugs one, and today I'm going to be specific on street drugs, and I'll be talking about amphetamines. Adulterated street drugs kills, and they kill very, very fast. Let me repeat. Adulterated street drugs kill. They kill very, very fast. Amphetamines as a group mainly works to increase dopamine by increasing its release or blocking its transport or preventing its reuptake. So making dopamine available in large quantity for nerves and for its effects. Dopamine is a neurotransmitter in the brain and also a hormone. In schizophrenia, there is increased dopamine level. So you can understand where we're going. So those who have been diagnosed with schizophrenia have high level of these neurotransmitters. Antipsychotics are prepared to decrease the level of this neurotransmitter and its effects. That is why they help schizophrenic people, because they bring down the effects of dopamine and its availability for the neurons. Parkinson's disease, on the other hand, have decreased level of dopamine from pars compacta of the substantia nigra through the nigrostriatal pathway of the dorsal stratum or the basal ganglia in the midbrain. So schizophrenic people have high level of dopamine. Parkinson's disease have low level. Restless leg syndrome, they have decreased dopamine also. Hence, we use dopamine agonists for the treatment of restless leg syndrome. So the same thing as in Parkinson, but it's opposite in schizophrenic patients because they have high level, then we'll bring it down. And those who have hyperprolactinemia is also opposite. They have high level and we'll bring it down. What are the effects of dopamine? You remember what the patient or the person doing drugs has taken is amphetamine, that he or she might not know what he or she will be up against. Dopamine, when in high level, affects your mood. Like I've said, schizophrenic people, attention. As a matter of fact, sometimes people are inattentive that they are wrongly diagnosed as ADHD. Increase in alertness, increase in happiness. It just, most of the people doing street drugs, they know what they are looking for. So it's okay, like euphoria, they just want to get high. They want to feel happy, want good mood, and they want to be active. They will get this with amphetamine. OCD, compulsion, just to keep doing things repeatedly, going back and forth, pacing around, very active and happy within themselves. But then they don't know that might be a kind of invitation to death. Sources of dopamine. Amphetamine is one. Dopaminergic agonists prescribed by your good doctors because you need them. And somebody is stealing from the people who genuinely need them. High tyrosine in food. I will not go into details of that because some people might take that advantage, and when they can't get amphetamine, they'll start sourcing for that. Physical activities, drugs like caffeine, magnesium, John's wort, antidepressants, bromocriptine, pramiprazole, etc. Modafinil, yeah, because it improves alertness. A lot of military people do that when they are on mission somewhere and they need to be active throughout. Modafinil, they do that. It increases dopaminergic neuron response. Amphetamine intoxication. When individual has taken amphetamine and is intoxicated, what are you going to see? It becomes restless, pacing around, walking around, getting very alert. Could become violent and need to call 911, call police to come and grab you. When you take the blood pressure is up there, increased blood pressure, increased temperature. Because they are restless, they're walking up and around and they're sweating, they become fluid depleted. And there could be seizures and then hallucinations, because seeing things that the rest are not seeing, feeling all sorts of sensations that the rest could not perceive. They become confused. And if it is in children, if a child should ingest it accidentally, the heart rate will be raised. Normally, in case they have high heart rates, and now it's going to go off the roof. It could be vomiting, and there could be seizures. What are the complications in amphetamine? Cardiomyopathy. That on its own can kill very fast and kill suddenly for that matter, because it will predispose them to arrhythmia and features of heart failure if there's cardiomyopathy. Aortic dissection, and that's an acute emergency. If not attended to within minutes, that may be the end of the life of the individual. Acute tubular necrosis, the kidney is shutting down and there's possibility of ischemic stroke in these individuals. Why will people taking amphetamine actually die? They could commit suicide, and they might even be ingesting other medications concomitantly in overdose, not known to them or actually known to them. In fact, how they get all these drugs is still a mystery to some of us. Stroke or heart and blood vessel related problem like infective endocarditis, myopathy, aortic dissection like I mentioned earlier, and intravenous methamphetamine is the source of infective endocarditis in them. Adulterated amphetamines with any other street drugs like cocaine and heroin, you to sit down and just imagine it. By the time we are done with presentations on all these street drugs, then look at it that all these side effects, all the features of acute intoxication of amphetamines, you combine it with dose of cocaine, combine with dose of heroin in one individual at the same time, you could see the reason why it could kill. Street drugs could kill and kill very fast. In conclusion today, my advice is don't do it. Why? It kills fast. Don't do amphetamine and don't do any street drugs. If you have any problem with this, by the time we're rounding up the last episode, I will tell you more on what to do, but let me quickly mention them today. Call somebody. Talk to your loved ones. Call somebody. Let them help you. Walk to your doctor. Confide in him or her. Seek the help. Be alive and be healthy.